All right, good morning. It's good to see everybody. For those of you who don't know me, I'm Elbert Huang. I'm the director of the Center for Chronic Disease Research and Policy. I wanted to welcome you to our 12th annual research symposium, which is a collaboration with the University of Chicago Medicine Section of Nephrology and the Transplant Institute, who helped to organize this event. So I first want to just for those of you who don't know about the Chronic Disease Center, just want to visit our vision and mission. Our vision is to create a world where healthcare research and policy seamlessly interact to improve the health of individuals at the risk for or living with chronic diseases. And our mission is to develop and study innovations in the care of individuals at risk for or living with chronic diseases, and to influence the policies that affect the financing and organization of care. So these annual symposiums we organize to bring together policymakers, clinicians, researchers to create networks and interactions to stimulate policy discussions, new research, and future collaborations. So I'm happy to also promote. We have within the Chronic Disease Center also for those who don't know this, we have a primary care research fellowship that's a 2-year fellowship funded by HRSA. It's called, the shorthand is PITCH. It's the Primary Care Investigators Training in Chronic Disease and Health Disparities Fellowship. And we train clinicians in primary care to become clinical investigators to improve health outcomes and care delivery for patients with chronic diseases from underserved backgrounds. It's a 2-year fellowship. We are open to clinicians of different backgrounds, nurse practitioners, physicians, pharmacists, and we have funding for a 2 fellows per year. And Dr. Lai Tirpong's here, who is our fellowship director. So if you have any interest or have somebody who is interested in this fellowship, please let her know. And I want to also encourage you to kind of stay connected with us after this event. After the talks, there'll be a QR code to get your feedback on the event and for future events as well. We have a YouTube channel. These talks will be uploaded to YouTube. You can look at our activities on our chronic disease website. We have over 30-something on affiliated faculty across the University of Chicago in different departments and divisions, and follow us on Twitter as well. So the master of ceremony for today's event is a faculty affiliate, Dr. Milda Saunders. She is an associate professor in this section of general internal medicine. She's also the University of Chicago's living donor advocate physician. She's a clinician and an investigator with specific focus on increasing health equity and improving outcomes for patients with chronic kidney disease through patient self-management, linkage to care, and quality improvement across multiple levels of care. She has a really robust NIH funded program to test several interventions for hospitalized patients with advanced CKD who sometimes don't know they have advanced CKD. That'll be a recurring theme. And she's trying to increase their knowledge about the different options they have for renal replacement therapy. So I'd like to bring Milda to the microphone.